Right, great. So, hi everyone. We are here with NAMI Delaware and PIC, Parent Information Center, in a collaboration together to have a conversation with an expert in uh, counseling for children and especially grief. Before we get started, I wanted to tell you a little bit about NAMI Delaware. You might already know what we do, but just in case, first of all, NAMI stands for National Alliance on Mental Illness, and we're in Delaware. Many of you are probably in Delaware too, but in case this video lands in some other state, don't worry, there is a NAMI in your state. There's a NAMI in every state. So you could go to namidelaware.org, our national agency, and find the closest NAMI office to you. You can learn about the programs and support groups and awareness events that might be happening in your area or with your state. Now, as for NAMI Delaware, we do a lot of programming. We offer support groups. We have housing actually at NAMI Delaware as well. And we've switched our programming online given the current circumstances. So this tonight is an example of a presentation that we could share with you with our friends here, with their collaboration, so that we can have a conversation around a really important topic. So I'm going to let our guests or our partners here introduce themselves, and then we'll get started. Tina?
Hi, my name's Tina Andrews. I am with the Parent Information Center. I'm a project coordinator there, and I work with our parent training and information program. So PIC has been in Delaware for 36 years, and we work all throughout the state with all of our families, supporting families of children with special needs, supporting all families in getting resources, information. In our previous life before COVID-19, we would go to schools, go meet directly with parents, and provide trainings and all kinds of services. We still provide those same services, but families now initiate that through the phone, and we use our Facebook capacity, just like NAMI is, and similar organizations, by doing Facebook Lives every week, and also webinars around issues that families are facing right now, and helping in any way we can to support our families throughout Delaware.
Thank you, Tina. Nicole.
Hi. So yeah, thanks for having me. I am a licensed therapist here in Delaware. I'm also a certified grief counselor. I've been doing counseling for the past 12 years with many different types of people, and I've really been specializing and focusing in on grief for the past 6 years. I help to run an organization, a nonprofit called Supporting Kids, which is in Hocassin, Delaware. And the mission there is really just to help grieving children and their families. So we have support groups, we have individual counseling, we see kiddos from 5 to 18, and also we're, of course, we're helping caregivers and parents and families at the same time. And I have a private practice in Wilmington called Riverfront Counseling, where I also focus on.
Great. Well, we're really glad that we could bring everyone together tonight to have this conversation. Obviously, NAMI Delaware's focus is to support and advocate and educate around mental health conditions. But right now, what we're working with and what we're dealing with, it might not be a diagnosis of a mental health condition, but we are all impacted. Our mental health is impacted with what we're experiencing right now together. So before I even ask a question, I want to make note for you of a crisis resource for everyone who's viewing this video, because what we're going to talk about tonight is about supporting our children, and that can inspire some emotion from us as parents. So I want you all to realize that there are ways to receive help immediately, and one really easy way is to text our crisis, or not ours, but text the crisis text line, and the number is 741-741. that is a national 24/7 response that if you text the word home and you let them know that you are in Delaware or wherever you are, you will get connected to a responder locally. And you can actually go back and forth with them and tell them what's going on. We want everyone to know that you're not alone. And what we're experiencing right now is incredibly impactful. So let's get started. Let's talk about the big picture here, Nicole. So we're all experiencing something that we have never experienced before. We've got feelings of fear and anger and anxiety. We really don't know what's happening. And we understand now, thanks to you and specialists like you, that this might be grief that we're feeling. Can you tell us a little bit how COVID-19 is actually, or what we're responding to with it, might be grief?
Yeah, that's such a good question. I think grief is most often associated with death, right? But grief is just a normal reaction to any type of loss. So, like at Supporting Kids, we talk a lot about there's sort of 4 main types of loss, right? We have developmental loss. So if you have a 5-year-old who goes off to kindergarten, right, there's a sense of developmental loss there, a loss of the aspect of some part of yourself. So when you have a child in the first place, if you're a parent, right, you can relate to that. Just losing a little piece of who you are. I know I definitely did.
Me too. Twice.
Yeah. So losing the sense of loss you feel when you lose a treasured object. Losing a necklace your grandma gave you, or if you're on vacation and you lose your wedding ring or something. So loss of a treasured object. And then of course, the 4th one is relationship loss, which is where death kind of falls, but also all relationships can be lost in so many different ways. So not just death, but the way that COVID-19 is sort of having everybody feel is definitely loss, right? And you feel that in all of those losses that I've just kind of described for you. We're quarantined, we're working from home, our kids have lost their connection to their schools, their teams, our poor seniors have lost, so much. And just being home and dealing with all of that, that sense of loss, right? That grief that's associated with loss. I think what I would say is that grief is normal, right? And it's expected, and it's not just associated with somebody dying, and that it's not an illness. It's a human process that we're all experiencing that same human process right now.
Oh, I like what you're saying. It's a human process. That actually really makes it feel a little better, right? And also just knowing that grief is normal and that it is grief. I think that is key. And the first time I realized that could be what we're experiencing, it really made a lot of sense.
Yeah.
Tina, did you have a question?
No, just I'm glad that we're able to frame it in terms of grief, because I think for some of our parents, that's something they are familiar with, and they know because they might have experienced it, that it is a process. And so at least for me, I have children as well. It helps that there are things that I can do to help with kind of this process, and there's hope that they'll be changed when we come out of this crisis, but that there is a growth and they will come out of it, and be happy or successful or whatever they were projecting toward.
Right.
Yeah.
So with the families at PIC, are they talking at all about behaviors that are impacting the family during this time?
Yeah, so I mean, we work with families from birth through 21, and a lot of the parents are coming to us, and they don't. This is new, and so just identifying what what behaviors you had talked in your intro basically about some of these behaviors could be tied to grief. What does that look like? What might they see?
Yeah, another good question. I think it's so hard to tell, right? Our kids it's 8 o'clock. They don't want to brush their teeth. They don't feel like going to bed. They're not tired. They need water, right? Like, and many more behavioral stuff related to that too, right? Like on each end of the spectrum. But it's so hard to tell, is my child really just not tired? Are they struggling with something? Do they just not want to go to bed? Are they trying to be defiant, right? It's hard to tell. It's hard to know. So just remembering that grief affects every part of a person, right? It affects our body, it affects our spirit, our emotions, our thoughts. And I'm going to include a resource page too of like all the developmental concerns for grief and how you can help. So I'll talk kind of broadly, but if you can reference that page, I think it'll be linked in like the comment section. But in general, for younger kiddos, we're going to see our kiddos are a little more egocentric. They have more questions. They have a more difficult time understanding things. They might talk about physical complaints, right? So they might have headaches or stomach aches. You could see a regression in behaviors, right? So if you have a kiddo who had a difficult time attaching, maybe from mom or dad, but had seemed to work through it and it was getting better, you may see a regression in that, right? They may go back to those attachment behaviors. And you may see them start to struggle a little bit with some of that. For older kids, you may see more anxiety, more ruminating thoughts, right? Fearfulness. Older kids can kind of understand what's going on a little bit better. So they may just be in general a little more fearful. The more you understand, the more fear and anxiety that tends to kind of bring in. And older kids tend to mask their grief with other more easily accessible feelings, right? So older kids are angry or they're super excitable, right? They're accessing emotions that are common to them. They're well known in their bodies and that's what they can put out. But sometimes we'll see that that's actually some grief happening inside. And when we're talking to kids about these behaviors, right, if we're thinking that this increase in negative behavior at bedtime is related to their grief from COVID-19 or from the losses that they are experiencing right now, it's okay to kind of help them connect those dots, right? So draw from your own experience, draw from, what's been happening to you and how you've been coping, and help them connect like, oh, this is happening. I'm wondering. Always approach things with a curious mind, right? You never want to go in like you have the answer or like, or you've already interpreted what's happening. Because as a parent, right, we most often do kind of know what's going on for our kids, but I encourage you to approach it with curiosity, right? So I'm wondering, I'm noticing, right, those kind of things. I'm noticing that you're having a hard time at bedtime. Can we talk about that? And you never want to have those conversations in the moment, right? Like everybody's screaming and trying to get their teeth brushed and running around. And that's not the time to kind of stop and approach it with curiosity. I think that's kind of the time to just try to move through the routine and get to bed. But maybe the next day, in a calm moment when nobody's hungry and nobody's tired, if we can find a moment like that, I know they're rare, really just trying to help them interpret what had happened during if we use that as an example, during bedtime, right? Kind of telling them what you saw, asking them how they were feeling. Maybe they can recall what it felt like in their body, and then helping them connect the dots to the losses that they've been experiencing, and offer your own experience at the same time.
Wow, I loved what you said about approaching it with curiosity. I feel like as parents, we do feel like we're supposed to know.
Yeah.
We're supposed to have authority and know the answers, but to approach things with curiosity really opens the door for bigger conversations and more, empathetic conversations, I would think.
Yeah.
That's great.
Yeah.
That's really great. So you mentioned bedtime. So that's a really good segue to another question we were curious about. What about sleep? Does grief actually impact our sleep, especially with kids?
Yes, definitely. Lots of kids will have nightmares, especially kids under 10, right? At that age, they're still trying to understand what's happening and make sense of everything. And I mean, at our age, we're still trying to make sense of all this, to be real. But especially at those younger ages, there's so much anxiety and just ruminating, and they're having all these thoughts. And even for adults, it's just natural for that to create a sleep disturbance, right? So I think start by recognizing that it's normal, right? It would be normal for your kid to have nightmares and for it to be related to the loss and the grief they're feeling from these losses. Of course, you want to always start with the normal like bedtime stuff that people everywhere tell you to do, like good sleep hygiene, going to bed at the same time, waking up at the same time, turning screens off a half hour before bed, lights off, that kind of stuff, which we're all perfect at, obviously.
Of course, I certainly am.
And then again, with the connecting the dots, really helping them to understand what they're ruminating about or what may be causing them anxiety or disturbing their sleep, and then answering questions, offering information, that kind of stuff to help kind of ease their minds and ease those feelings that they're having so that they are having less sleep disturbances.
Great. Thank you.
One of the questions that we get, we have a lot of children right now that are separated from loved ones, from parents and grandparents, aunts. And I know some families are trying to do Zoom birthdays and drive-bys and those kind of things. But at some point, there are some children that developmentally don't understand that. Why can't I hug grandma when we go see her? And then even older, they may cognitively understand, but still not understand, why we have to do this. How would we support those children?
Yeah, it's so hard. We want to have a balance, right? We want to help kids to feel safe and supported and not overwhelmed, but we also want them to have information and facts, right? So making sure that there's some kind of a balance, and the balance is going to look different based on how your kiddo is, what their personality is like, based on their age, right? You may explain and do things differently for your 5-year-old who's super anxious already versus your 13-year-old who may be a little more laid back. So keeping all of that in mind, right? I'll probably say this 10 more times, but your kiddo better than me, better than anybody. Maybe they know themselves a little better, not sure, but you know them well, right? So you always want to keep that in mind whenever you take anyone's advice, is listen to it, hear it, and apply it as your kids need it, right? As it applies for your children. But we really want to make sure that we're offering concrete, honest information, age appropriate. So I'll say too that if you are not the person who can talk about germs or who can talk about even just what's happening right now with COVID-19 itself, like the science of it, right? Either maybe germs kind of freak you out, or maybe the science of it, you're having a hard time understanding yourself. It's totally fine to pass the baton, right? This may be a moment where you're like, yeah, I need help. I don't got this.
Right? Tag, you're it.
Yeah. So maybe your partner is better with this. Maybe you have a friend or another family member that's better at just even sometimes explaining things. I'm not the best person to explain anything. So I pass that baton on to my husband all the time, right? I'm just like, I can't explain this. You got this? I can cook. I'm going to go do that. So never let that, it's okay to not have the answers. But yeah, we really want to make sure that we're talking about the science behind COVID-19, right? What are germs? How do they spread? What populations are more vulnerable than others? Why are they more vulnerable? Kids do better when they have concrete, solid stuff to hold on to. I promise you can give them the information and it's way better than what they're making up in here. So just give them the information, help them to understand it, answer questions, but just be as honest as possible.
That's great. That's definitely important. So when we're thinking about different developmental stages that children are in, it calls to mind the idea of parents of very young children, babies, toddlers, or parents of children who are nonverbal. Perhaps they live with a disability that does not permit them to express themselves.
Mm.
What does grief look like for them, and what might parents need to be tuned into with their own grief? Because we've all decided we're all grieving, right?
Yeah.
So how is it, what can parents do, I guess, is my question there.
Yeah, babies, toddlers, kids who are nonverbal, they all can be affected by a parent or a caregiver's own personal grief and stress, right? We want to make sure as parents, caregivers, that we're being genuine and we are modeling emotion. That's so important. If you're feeling sad, it's okay. If you're feeling a sense of loss, that's totally fine. But just keep in mind that children under the age of 2 and nonverbal children, they can sense that something is different and off, right? It's like a feeling that they get. They pick up on all of the changes in the moods and the changes in the emotions, and they don't have words to put to that, right? They can't say like, Mommy, what's wrong? Or Daddy, what's going on? Or Aunt so-and-so, you seem really upset today. But when they sense those changes, they show it in their behaviors, right? So you may see an increase in clinginess. You may see an increase in irritability. You may see that they're not interested in doing like their normal stuff that they like doing, and that they're more interested in you as the adults. What are you doing? What are you focused on? So that they can really be in tune and in touch with your mood and your emotions. So you just want to, they're just trying to watch for those changes and take cues from us, right? And again, you want to be honest and genuine with your emotions, but also just be aware that our kids are picking up on that, especially the babies, toddlers, nonverbal, right? They're picking up on that. And so how do you make sure that you're talking to them about it, make sure that you're giving physical reassurance, right? Like physical affection, offering the comfort items more than you normally would. So if you're seeing like an increase in irritability, it's totally fine to just offer those comfort items more than what you would under normal circumstances. Right. What else would you want to do? Just making sure that somebody is emotionally available for them at all times, right? And it doesn't have to be you, whoever you are watching this, it doesn't have to be you, but somebody should be assigned to be, for babies, toddlers, nonverbal children, somebody should be assigned to be their sort of emotional support system at all times. They have to have somebody available and accessible that they can rely on for that emotional stuff.
That's good.
So you were talking about the parents' feelings and how that transmits to the child. We know that unfortunately there have been deaths of family members related or not to COVID-19 in this period, but I do feel like this is unique in that the usual expressions of grief, funerals, and going and saying goodbye are not available. How can you explain that to children and help them through that process of the grief of a death of a loved one right now?
Yeah, I think explaining to them what's happening, right? So if you've set the foundation of honesty and offering concrete information I was talking about before, if you haven't set that standard now, like start setting it, right? But in those moments, you really, we need to just, again, be offering that honest information. Here's what's happening in the world, right? And I think as parents, sometimes we want to shield our kids from what's happening, and to a certain extent, like there's definitely some shielding that should go on, right? But because we always want to be age appropriate and we want to monitor the things that are coming, that we want to filter the things that are coming in for our kids. But I think sometimes we as parents tend to forget that kids are also human beings and that they can understand and interpret the world, and they do it their own way, based on who they are or their personality or their age, but that they should be given the opportunity to try to understand what's happening. So just explaining to them, I know the instinct is sort of to say, like, everything will be fine, no, nothing bad is going to happen. That kind of stuff, I think, is what rolls off the tongue pretty easily, because we want everything to be okay and we don't want anything bad to happen. But I would say, just to try to offer the information that you have, offer the explanations for these things that are happening. And once you've built that foundation, just offering consistent love and support to help them process through that information, right? It's not going to be easy to talk about it. It's not going to be easy to tell them how things are going or what's happening, or even to explain it. But once it's out there, just really making yourself available for support and just consistent love, and understanding and availability for questions. And I think that that'll be how these kids kind of get through it.
Yeah. And, Tina, you mentioned funerals, right? We can't have those funerals. I'm wondering, just thinking out loud, perhaps families could have some sort of closure event in their homes, right? Maybe we could, create some opportunity for kids to express their sadness, right? And I'm sounding like I'm an expert, and I'm not at all, but I'm just thinking out loud, like, it feels like we have to really think outside the box right now, right?
Yes.
We have to think about creative ways to provide what our kids need in this really weird scenario.
Mm-hmm.
So I was just thinking about that out loud. Hopefully that landed okay.
No, I would just add to that to always include them in the conversation.
Yeah.
So if let's say grandma dies and you can't have a funeral and we can't do these things, right? Talking to and including the kids in the decision-making process, right? Do we want to plant a tree out back? Do we want to make memory boxes? What do we want to do? What are the options? Discuss it as a family, right? There's always going to be boundaries or limits set by the adults, but
Sure.
within those limits and boundaries, what does everybody want to do? What's the consensus of the group? And, maybe these two kids want to do it this way, but this one wants to do it this way. And maybe there's room for all of that. But I just think it's so important to include them in those conversations.
That's great. And really at any age, right?
Can I add too? I just want to recognize for parents that are watching this is hard. That we're talking about it, how it's affecting children, but just a recognition that there are some adults right now that are going through some of the worst times, losing family that they can't see, that they can't be with, and that I know it probably feels really hard to also manage your children's grief while you're grieving. Nicole, is it okay if children see that grief? I know that there are some parents that want to hide it, or not hide it, but minimize it. What are your thoughts on how that's expressed? Because I know there are parents that are grieving right now.
Yeah, I will say most of the families that I see, so part of what I do with supporting kids is I have a sort of a consult with the adults in the family first before anything else kind of happens. And it's so common for the adults who come to those consults to be either not being able to cope with or think about their own grief because they're so focused on how to help their kids grieve. And I mean, it's great they're coming out and getting support, right? They recognize that and they're trying to get help and support with it. So it's definitely super common. There's no manual or right way how to figure out how you cope with the loss of your mom and also help your two kids deal with the loss of their Nana, right? That seems impossible. So I think modeling your emotions, modeling that grief is totally appropriate. And when we model our feelings and emotions, we signal to our kids that it's okay for them to have those same feelings and emotions, right? if I can say like, I'm really sad and I'm grieving the loss of Nana, I miss her so much. That opens up the door for my child to kind of be like, yeah, I really miss Nana too. And I'm having a really hard time sleeping at night. And I might be like, I'm having a really hard time sleeping at night too. Right? Do you want to sleep in my bed? Because I think that would help. So I think, yeah, you're so right. And it happens in the reverse order as well. When I see kids who are grieving, parents protect kids, but kids are also protecting their parents, right? So they don't want to upset the apple cart either. So a lot of kids are not showing their true grief at home because they don't want to upset mom or dad or whoever's home with them, right? They don't want to, for a kid, they don't know if that's going to affect, are we going to still go to Rita's tonight? Are we, right? Or, from that basic level all the way up to like, I don't want to see my mom upset. I don't want to see people crying anymore. So we're doing it to the kids and the kids are doing it for us too. So I think just trying to model that it's okay.
Yeah. It seems like what the kind of the general theme tonight is honesty and being okay with how we feel, right?
Yeah.
And communicating those feelings. All right, we're coming up to the end of our time together, but I wondered if you could give us one more practical thing that we could take away, something that really is tangible for us to understand how to respond to our kids.
Yes, definitely. I would say that if we could practice empathic responding, and all I really mean by that is just offering genuine responses to our kids that let them know that we've heard them and that we connect with them on an emotional level. Really, that's like the core of empathic responding. So not trying to, so if our kids are coming to us and they're expressing feeling or emotion, not trying to jump in and fix it, right? Not saying, yeah, but like, I know it's hard right now, but you have this play date coming up or whatever, right? Like not trying to fix it, not trying to deny their feelings, right? So we don't want to say like, oh, there's no reason to be upset, that kind of stuff. Right. We want to try not to give advice, not to say like, you should do this or you should do that. We don't want to give pity, right? We don't want to be like, oh, you poor thing. I know, like that. So empathic responding, I'll sort of give 4 ways that we can do that. So one is to sort of just repeat back the message you heard, right? So if your child says like, oh, I was at the movies this weekend, I literally just mean repeating back, oh, you were at the movies this weekend. Right? You heard them, you're connecting with them, you're emotionally available, you heard what they said, right? Okay. You didn't ask any questions. You didn't just, I heard what you said. I'm here. We could label their feelings, right? So if they were like, I went to the movies this weekend, you might be like, oh, you're excited that you went to the movies this weekend, right? Okay. Just kind of labeling and repeating back the feeling that you heard. You don't want to interpret it, but you just want to label it, right? Okay. We could do a nonverbal cue that we're listening and that we're being genuine and responding empathically, right? So just simply right? That right. I'm listening, I'm nodding my head, I might be smiling. Right. I do a lot of nonverbal listening. So that's my go-to. And then the last one I would say is sort of giving into their fantasies or their like wishes. So this one sounds a little weird, but I'll try to explain it. So if your kid is like, oh, I just wish I could be with my friends right now. This is terrible. I just really wish I could be with my friends right now. And not trying to fix it, not trying to interpret that, not trying to twist it into something else. Just maybe you just go there with them with curiosity and sort of say like, what would you be doing if you were with your friends right now? And let them explore that, right? Like, don't try to make it okay that they're not with their friends, and just try to give into that fantasy with them and help them to explore it. So yeah, I would say, and I'll put a little sheet of examples of how to respond empathically to different things. It's something that we use at Supporting Kids a lot, but just really genuinely responding and being there. And of course, that means that you have to be it present in the moment. So not doing anything else at the same time. You don't want to try to be an empathic responder while you're also, texting and doing whatever else. Because I'm definitely guilty of that.
Right. It's hard to show empathy when you're not paying attention.
Yeah.
Right. Well, those are all really great. And I see that Wesley has been posting the links that you gave us with some resources and as well as that empathic response PDF. I'm just going to throw it out. If there's anybody out there who has any questions for us before we finish things up, please pop those into the chat. And otherwise, I think we can just wrap things up. And I think we covered a lot tonight.
Yeah.
And I hope that this video can be supportive and help our parents help their kids. And just to address the fact that what we are all feeling is grief, and our kids might display it differently, but if we can be open and honest, like Nicole talked about, and developmentally appropriate, we can help them through this really difficult time.
For our families, we have resources on our website, picofdel.org, PICOFDEL. And, we know that families are struggling with figuring out how to school, to work effectively with schools right now, especially in regards to IEPs and 504s and what transition back into school looks like. And there is grief in that for many of our children who love their teachers and their classrooms and their routines. So we are continually updating that with resources, both informational about what policies are in place and things like that, but then also connections to NAMI and, some of our other organizations that we partner with for all of our families. We also have a lot of resources in Spanish for our Spanish-speaking families, as well as a weekly Facebook meeting. Actually, I think it's a Zoom meeting, but so if you are Spanish speaking and also are dealing with these, please reach out and we can connect you to that.
Great. Nicole, did you want to tell anybody about supporting kids or anything else before we finish up?
Yeah, definitely supporting kids. We're still open and kind of doing things mostly like this, right? On video.
Yeah.
I've been doing plenty of consults and talking with new families who have lost a loved one, trying to help them navigate that. But certainly, reach out if you feel like you need something. And of course, I have my private practice. And I would just say, just for everyone, just to remember that grief is totally normal. Mm-hmm. And I know I make everything sound so super easy to implement and to do and think about. I know that it's hard, but just being aware of it is, honestly, number one. And just move forward with your days as best you can. And just try to validate feelings and, again, just normalize grief.
Yeah, and I would piggyback on that. If you feel like all these tips and strategies aren't enough and you're still struggling, ask for help.
Yes.
There is courage in asking for help. It is courageous. It is not a sign of weakness. It is a sign of strength. So please look out for us. All our agencies are available and working now for you. So I'd like to thank Nicole and Tina for being with us tonight, and hope you all stay safe and healthy, and all is well with our sunshine coming down, I guess, tonight. But tomorrow, there's always tomorrow, right? Okay. Thanks, everybody, and good night.
Thank you.